Hi Vikki.
Oh, hi Janet.
So you're a science staff tutor. Can you tell me a little bit about your research and your area of expertise?
So my background's in cancer research, and I'm particularly interested in the molecular changes, so I'm a molecular oncologist. And that really started when I did my master's with the Open University several years ago. I knew I was always interested in cancer and wanted to get into research, but I wasn't quite sure which particular area. And as I progressed through my master's, it became apparent that I was more interested in the molecular changes. I was then fortunate enough to be able to go and do a PhD, and I've been working in cancer research full time, more recently particularly focusing on breast cancer.
So that's your past research. Is there something particular that you're working on at the moment?
So my more recent research has been looking at how patients respond to treatments in breast cancer. And particularly some women might initially respond really well to treatment and stop responding to that treatment over a period of time. And other women just never respond. And the molecular reasons for that just really aren't very well understood at the moment. So I've been particularly interested in a very tiny molecule called a microRNA and the role this might play in the resistance to these treatments. The other benefit with microRNAs is because they're so small, they tend to enter the bloodstream. And what this means is that we can actually measure them by simple blood tests. So it might be in future that we can actually take a simple blood test to work out which patients are going to stop responding to the treatments.
So how does your research feed into OU Teaching Excellence?
So I think this is a really exciting period for me because I've been teaching with the Open University for almost 10 years now. And I've joined full time, and I'm currently involved in production of a new module where we're going to be using a lot of health science topics to teach students about science. One of those topics is about screening and breast cancer. And I'm leading a team of scientists to write this module. And I'm particularly focusing, my section is going to be about the molecular changes that happen in breast cancer.
Now you work in a lab using thin sections and a microscope. How are you going to try and give the students a similar kind of experience?
I think one of the benefits these days of technology is that we can actually generate a virtual microscope. So every student that's studying with the Open University will have that type of experience in their own home, which I don't know if you can see on the screen here. And we're going to have some breast cancer cells and breast cancer sections. The students can measure the cells, they can look to see whether the cells have stained for a particular molecule that we might be interested in. So what we're looking at when we're looking down the microscope is we've got a section here in the middle, and we've got various different objectives. So they help us to zoom in and zoom out at various specific parts of the slide that we might be looking at. And these correspond to the objectives that we have on a real microscope. But what you can see now is that we've gone out of focus, so we need to play with the focus.
Oh, it's going worse.
Oh, no. This is what normally happens when you look down a microscope, you make it worse. So we can make it a bit clearer by playing with the focus.
Oh, it's better.
We can also play with the lighting if it's a bit too bright or if we need to make it lighter. And these are all the sorts of things that when I look down a microscope, I'll be playing with to try and get the best image of the slide I'm looking at.
Now, you work in the area of cancer, which is a really emotive subject. Having that inside knowledge, are you optimistic or pessimistic about us finding a cure for cancer?
I think, to start with, I think cancer is not one single disease, and I think this is something that most people aren't aware of. So breast cancer is very different from colorectal cancer, from prostate cancer. But even within breast cancer, we know there are 4 different subtypes, and these are already being treated in the clinic. So if a patient is very unfortunately diagnosed as having cancer, one of the first things that will happen is a histologist will have a look at their section, they'll stain for various things, and depending on the outcome of those tests, a patient will be put into one of the 4 subtypes of breast cancer. And the treatment that they're then given will very much depend on which of the subtypes they've got. So I think to say will we have a cure is a bit misleading, but certainly the advances in treatment based on the molecular knowledge that we're getting from the lab have really significantly improved the outcome of a lot of cancer patients. And I think I'm very optimistic that we'll make huge advances over the next few years.
Vikki, that's marvellous, and can I wish you every success with your research? Thank you.
Thanks, Janet.